that right now. We are very, very happy to have Osama Alshogran talking about perspectives from Jordan about implementation of interprofessional education. So, Osama, I'm going to turn it over to you, and feel free to ask questions in the chat. Richard, Pitt, and I will be monitoring the chat for any questions you ask. Okay, thank you. Good luck.
So thank you everybody for attending today, and thank you for giving me the chance actually to share some of the observations about the perspectives of interprofessional education here in Jordan. And I think a good start of my presentation is to introduce myself. So basically, I am originally from Jordan. I had a pharmacy training background. So I did my PS in pharmacy and MS in clinical pharmacy from Jordan University of Science and Technology. And then I moved to the US in 2010, and then I did a master's of clinical research at the School of Medicine. At the same time, I was doing my PhD in clinical pharmaceutical sciences at the School of Pharmacy at Pitt. That was followed actually by 1 year of another training at the School of Medicine as a postdoctorate. And I did all these between the period of 2010 and 2015. And then I moved back to my home country, Jordan, as an assistant professor in the School of Pharmacy, where I got appointed in there. And currently, I am an associate professor in the Department of Clinical Pharmacy at JUST. JUST is Jordan University of Science and Technology, again. And I am, at the same time, a visiting scientist at the University of Pittsburgh. I am in a sabbatical leave. That will be done actually by the end of this month. So, I served actually in various administrative positions at JUST. So I used to be the dean, the assistant dean, sorry, of the experiential training. And then I served as a chair of the Department of Clinical Pharmacy at the Faculty of Pharmacy at JUST. Then I moved to the King Abdullah University Hospital, and then I served as a chair of the clinical pharmacy department in the hospital. So, I developed actually my interest in interprofessional education during my service as all these administrative positions, and at the same time I used to coordinate students training in the hospital, where they have to do some experiential training during their study for the PharmD students. And I teach also some of the therapeutics courses that require all of them understanding of the major aspects of development of pharmaceutical care plan for the patients to improve the patient outcome. So before we get to the data of interprofessional education and what we know about Jordan with regard to that, I think a good start is to let you know that Jordan is a country in the Middle East region, and it's about 10 million people in there. We got some refugees from Syria and the neighbor countries. We used to be like 7 and 8, but we are now almost, I guess, 11 millions. So Jordan is a country that is, in terms of education, I think people are well educated in there. We have a total of 28 universities in Jordan, distributed between public and private universities. And if you look at the map in here, the green one are basically the private universities, and like the red one are the public universities. So the distribution of these universities, if you can see it, mainly it's in the north or the middle region of the country. And that's in part due to where most of people they live. And, a lot of people usually they go to the north and middle region. It's close to the capital of the country. So that's why we see many universities at that region in there. But a lot of universities in Jordan, they offer health profession disciplines as like major for students to study there. So we have 23 universities offer health profession disciplines. And when I say health profession disciplines, that mean any of these. Could be medicine, dentistry, pharmacy, nursing, allied medical sciences, and clinical nutrition. And these are distributed between different faculties or schools in these universities. Like public health or community health is usually part of the School of Medicine, so I don't have it in there, but these are basically the major disciplines, the health profession disciplines that we see in Jordan. But there is a big actually jump in the number of schools that they offer these health profession programs. So from these health professions, you can see that the pharmacy accounts for about a quarter of these professions in Jordanian universities, a little bit lower for the nursing and medical sciences programs. Dentistry is not that much common. We have like maybe 2 or 3 universities offer the degree of the dental medicine. And we also have the medicine that accounts for about 11% of the total health profession schools in Jordan. But as I said, there was a big jump actually in the number of schools that they offer health profession programs in Jordan. And since I'm a pharmacist, if you look at the figure in here, in 2005, 8 schools in Jordan, they were just offering pharmacy degree. But nowadays, in 2023, we have 18 universities that they offer pharmacy degree. And when I say pharmacy, it could be pharmacy, BS pharmacy, and we still have BS pharmacy in Jordan, and doctor of pharmacy or the PharmD degree that offers by 2 or 3 universities nowadays in Jordan. So about, in terms of percentages, about 80% of universities in Jordan, they offer pharmacy degree. So clearly there was a growth, really a growth in the health profession schools over time. And as I told you at the beginning, I'm from JUST, Jordan University of Science and Technology, which is really a big university in the north region of Jordan that offers basically all these health professions. We have medicine, pharmacy, PharmD, dentistry, nursing, clinical nutrition, and the allied medical sciences. So that was like a brief introduction about what we know about, like health professions in Jordan. Speaking of interprofessional collaborative practice in Jordan, before we get to the interprofessional education, so there are multiple studies that have been conducted in Jordan that were exploring the impact of multidisciplinary, like care team in patient outcomes. And I think the majority of these studies were mainly focused on the role of clinical pharmacists, on the impact of the delivery of healthcare and optimizing patient outcomes. The first one here is one of the studies that my group actually has done recently, where we assess the clinical pharmacist role in enhancing hemodialysis patients, adherence to the recommendations, clinical outcomes, hospitalization, and there was a significant impact actually of the clinical pharmacists improving patient outcomes, and that demonstrates basically the big impact that the clinical pharmacist might have as a part of multidisciplinary healthcare team. And there are also multiple studies, as you can see in here, that highlights the clinical pharmacist role in the management of blood pressure, metabolic syndrome, asthma, and a few studies there focused on the effect of the relationship between, or the collaboration actually between the physician and nurse in improving the patient safety and outcomes. So clearly, many of these studies have shown that interprofessional collaborative practice improves health outcomes. And it's really necessary to work together as a collaborative team when we deliver the healthcare to optimize the patient outcomes. And that's, as everybody knows, that the major, merit of the interprofessional collaborative practice. And they came out to the conclusion that, providing interprofessional workshop or educational workshop for healthcare providers would be really necessary to optimize the delivery of the patient care. And I think there are also a lot of studies are ongoing now to highlight the role of interprofessional collaborative practice in improving healthcare, delivery and patient outcomes. Speaking of interprofessional education, however, not that much that has been done in Jordan regarding to interprofessional education, despite the fact that, like I think the primary medical school in Jordan was established about 50 years ago. And despite the long-term history of health professions in Jordan, not that much has been really conducted about interprofessional education in relation to improving, like the patient outcomes or educational maybe outcomes. So what we have known is actually, I know that there are some cross-sectional studies that are ongoing that are assessing the students' knowledge and perceptions about interprofessional education and implementation of IPE within health professions curricula. And these cross-sectional studies were targeting students or faculty members at different health profession schools in Jordan, but the data are not out yet. There are also multiple initiatives to develop activities and workshops at institutional levels or maybe university levels. And one of them I will be presenting actually today. It's the major workshop that I have coordinated in JUST about IPE in health professional schools. And these activities, I guess, some of them were, like directed as maybe a personal interest for researchers who are interested in doing interprofessional education, but some of them are really directed by the accreditation requirements. A lot of schools now in Jordan have received, pharmacy schools basically have received the accreditation from the Council of Pharmacy Education from the US. And some of the nursing schools have also received Accreditation Commission for Education in Nursing. So these accreditation standards, basically, they usually require the integration of interprofessional education in health professions curriculum. So that was actually one of the driving forces for organizing some of these activities and workshop in health professional schools. But it's expanding, I guess. There's a growth in the awareness about IPE and collaborative practice in Jordan, and people are getting more excited and interested in conducting some research about that. And we have some members from Jordan that are part of the Interprofessional Collaborative Arab Network, which was basically an emerging network with an Interprofessional Global. And we came to the agreement actually that we're going to call it as Interprofessional Collaborative Arab Network, IPCAN as a short. And we have conducted many meetings during this network, like development. And we try actually to have it like a formal network with an Interprofessional Global. And Dr. Ala Al-Awisi from Qatar is the leader in that perspective. So next, I want to just share with you some observations about the interprofessional education activity that I have coordinated in Jordan. And I thought, before going forward and having a clear idea about how we're going to implement or integrate IPE within health curricula, we need to hear from students first. There's not that much data published so far about the awareness, attitudes of a student about IPE. And I thought that let's start with the students first. We have to hear from them about whether they are ready, have positive attitudes about IPE and its implementation in the curricula. And that was actually the goal of the study. It was, I would call it an interventional study because we have intervention in there, which is basically the interprofessional education workshop. And the goal was to explore the perception and readiness of health professional students about IPE and collaborative practice before and after implementing such an IPE activity. And the ultimate goal really is to draw a path about how we're going to integrate in a strategic way IPE within health profession curriculum. So we're going to have kind of foundational piece of information about what we know, whether students are ready or not, whether they have positive impressions and attitudes about IBE, and we're going to go from there to have some ideas about how we're going to implement IBE in the curriculum. So the study design, as I mentioned, it was an intervention and reflection of learners on the experience. And I think starting doing such IP activity for the first time is not easy. And it was really exhausted and taking a lot of time. And I thought nobody can do it by himself. You need like some collaborators from other health professional schools to design and implement such an IP activity. And that's what I did at the beginning. So I started reaching out to some faculty members in the health professional schools who are interested in IPE, and we form kind of a small committee from these faculty members to take the lead in organizing such interprofessional education workshop. So since it's like the first time to do it, I thought that let's consider that as a pilot study, a pilot investigation, and we start low and go slow, sometimes we call it. So we're going to start with a small number of, the major maybe health professions that contribute to healthcare, and we choose the case of diabetes, and we thought that we start with pharmacy, medicine, nursing, and nutrition would be a good, a good start for such an IP workshop. So that was conducted in January 22, and we did visit students who are at senior level in their education. And we got senior students because we need students who have the knowledge, who have developed the knowledge and skills to practice actually in their professions when they get to the workforce. And so I did visit students at their classes to describe the goal and objective of such workshop, and to get some names for students who are interested in to be part of this workshop. And a lot of students actually were interested, but we were limited by the number. And initially we thought that we're going to start with a total number of 50, 10 from each program, 10 pharmacy, 10 PharmD, nursing, nutrition, and medicine. And we randomly basically selected students to be, part of this workshop. We did not look at educational level in terms of, their grades, something like that. We need just to have a representative sample of these senior students within this workshop. So we get the names. We got about 50 students, and we have some backup names in case some of them did not show up in there. But so we got these students, and we distributed them randomly to healthcare teams, we call them. And we have a representative, at least one student from each discipline within this healthcare team. And before conducting the IP activity, and as I told you, this is pre and post study. So at the beginning, we distributed a scale for them, or an instrument that measures the attitudes, their attitudes and perception about interprofessional education. We utilize in here IPAS, which is a well-known tool, Interprofessional Attitude Scale, that assesses student perceptions and beliefs or attitudes about interprofessional education and collaborative practice. And the survey was distributed online to them, and they did that. We gave them a week to do it before getting to the interprofessional workshop. So and before actually we got them to the teamwork, we provided them with some education material about the focus of the clinical study, which was diabetes in this case, and we provided them with some videos to listen about what do we mean by interprofessional education and collaborative practice. So they kind of revise their information to get ready for the interprofessional education workshop. So we got in there, we distributed them into 7 teams. 6 or 7 students per team, and we have a facilitator within each team just to organize things, facilitate the discussion between students within the team. And that was a 3-hour interprofessional workshop or educational activity. And I will go in more detail about what we have done exactly within this activity. And after that, we asked them to do the IPAS again, and we're gonna see if there was like a difference. Knowledge have been improved, the attitudes have been improved after implementing such IPE activity. So for any educational activity, we should have like learning objectives, and we develop such learning objectives just to, like to cover the concepts that are related to interprofessional education and collaborative practice, and to meet the standards for the core components of the interprofessional education and collaborative practice. So the major objectives were to provide students from health professions with the opportunity to learn about and with and from each other, and that's really the merit of the IPE. To get the chance that they discuss their roles and responsibilities within an interprofessional team, and to prepare them to practice actually in a collaborative team when they get to the workforce. So within the interprofessional workshop or IB activity, it was broke down as the following. So initially, we have prepared a presentation about IBE just to get the student familiar with the topic. So we gave presentation about interprofessional education and what are the major objectives of such workshop and what's actually expected from students to do in such activity. And then they were distributed, as I said, into teams, 7 teams, and with a facilitator in there. We started with the facilitator introduction, and then they had the icebreaker step just to get to know each other. And then, like the major part of these 3 hours was really the case discussion and the development of interprofessional care plan for patient management, which was related to diabetes. So that was maybe about 2 hours of their time, just trying to work together as a team to know their roles and responsibilities within a healthcare professional team, and what could, like profession contribute in a way or another to develop the, pharmaceutical care plan for the patient management. And after that, at the end, we have a debriefing step where we had like representative students from each team that share with the whole group about, like contribution of, like every profession about the development of the plan for the patient and the patient care. And we ended up the interprofessional educational activity with like reflection on the experience. We had like qualitative questions. We have a discussion in there about what students did like about such an activity, whether they have any concerns, whether they like it or not, any recommendations for future activities, and so on. And I want to share with you some observations about these perspectives as well. So, so at the beginning, when we do think for the first time, I think we should have some consultations. And Dr. Ala Al-Awisi, we get the privilege actually to know her during our meetings during the COVID-19 actually. And she's an expert. We know that she's an expert in interprofessional education. And in Qatar University, they have a committee that was established actually in 2014, and they have done a lot of workshops and activities with this perspective. So she was with us actually as part of the committee, and we had to consult her a lot about the case development, the organization of the activity, and so on. And she was really helpful. So the data that were collected from students, and as I said, we distributed a short survey on them about, we get some data, demographics, their disciplines, age, gender, and how far they are in the program. And the major part of the survey was really the Interprofessional Attitude Scale. And that scale was true because it was designed actually based on the core competencies of the interprofessional education collaborative. And for those who are not really familiar with IPAS, it's a 5 subscales instrument that has a total of 27 items. And each statement, it goes from 1, which means strongly disagree with that statement, to 5, which is basically strongly agree. And the 5 subscales, they cover the teamwork, roles and responsibilities, 9 items in there, patience and fairness, interprofessional biases, 3 items, diversity and ethics, community centeredness. And, like in each statement, these kind of statements, they reflect the major components or the major competencies of interprofessional education and collaborative practice. And students in there, when they read these statements, they have just to pick whether they agree or disagree with that specific statement. And when we get higher scores in there, that means that they have a positive impression or positive attitude about interprofessional education and collaborative practice. So we get the scores before and after the interprofessional education activity, and we summed all the score and we had the average at the end out of 5. So the data that will be presented today will be out of 5 as a score. And we also ask students after doing such activity to rate the activity out of 10 and to provide some reflections, their perception. There was a drop list in there, whether they like it, was interesting, theoretical or practical. And, like each student can pick more than 1 item about the perception of the IPE. And we ended the activity about what the major challenges, what they think about such an activity, whether they like it or not, whether they feel that they worked as a team to solve the problem and to develop the pharmaceutical care plan. And we had some recommendations from students just for improvement. And whenever we do another future activities, we can implement such recommendations and feedbacks from them. So we get some pictures from there. This is the very initial beginning of the IB activity, where I gave presentation about interprofessional education and the expectations from this activity. And this is where the students, they had to work in development of pharmaceutical care plan as a team. And we can see here we have representatives from each discipline. And after that, we have a debriefing step where representative students had to go there and present their thoughts about that, team-based plan. And at the end, we just provide them with such certificates, and we thank them for the contribution on such an activity. So in terms of data that we got, the total number of students who completed actually the pre and post activity was 41, and that's the number of students who were included in the analysis. We have more females than males, which is actually expected, as the majority of these health profession students, usually we see more females than males in the classes. The age is between 21 and 27 years, and we have a good representation from all these health professions. The number of students kind of similar between the professions, and we made sure that we had 1 student from each profession in the team. And they were in their 4th to the 6th year, depending on the program. Some of the programs in Jordan, we have like 4-year program for nursing, for example, for clinical nutrition. We have 6-year program for doctor of pharmacy and medicine. And only 6 students had previous experience with IPE. So looking at the IPAS score, so generally speaking, the score, if you look at the pre-activity in here, the score were generally positive. The total score was 4.2, almost out of 5, which means that they have generally a positive attitude and perception about interprofessional education and collaborative practice. In terms of the subscales, also we see almost high score with the teamwork, roles and responsibilities, patient centeredness, and the lowest score was actually for the interprofessional biases. But looking at after implementing such an IP activity, the both activity scores were increased actually for all of them, and the majority were significant. So the total IPAS score was significantly improved. And looking at the subscales, the three of them were actually significant. Significant, the teamwork, rules and responsibilities, the diversity and ethics, and the community centeredness, which means that, after implementing such an IP activity, the positive impressions that the student had before have been improved after doing such an IP activity. And I think they were strengthened and, like after such an IB activity, the thoughts that they have been solidified after the workshop. So the perception that we ask about the IPE, and we have a drop list, as I mentioned, most of the students have generally positive perception and experience with the IB activity. More than 80% actually said that it's practical, enjoyable, interesting, valuable. Only one student mentioned that it was boring, and I think 2 students out of 41, they said it was repetitive. In terms of the student reflections on the experience, we asked students whether they like it or not, and all of them, they said yes. And I think the rating out of 10 was 9.5, which is extremely high for such first IP activity. And all students actually agreed that this IB activity is highly recommended for other students who have not joined today, and they recommended such an IB activity for other students. So looking at what they like about the activity, the major statements in here actually, I think they reflect the major aspects of IPE. When you look at some of them, they said, I liked a lot the teamwork aspect of such an IB activity, which is one of the core components of IPE. Another student says that what I like to hear is learning about other professions, which is actually to get to learn about other people in healthcare team. That's actually another core component of IPE. Knowing the rules and responsibilities of each profession, that was actually another aspect that they enjoyed about such an IP activity. And in terms of challenges and recommendations, some of the challenges that were mentioned by students, that I think some of them, they said it's difficult to gather a large number of students, and we agree with that. Some of them, they like to see more practical aspect of such interprofessional education. And we need to do more and more of such an IB activities during our study, just to get ready actually for a collaborative ready workforce in the future when they get to the work. Some of the challenges and they were looking to have other health professions, and I think during their discussions they realized that some of the professions are missing in the team, and that was acknowledged by them actually. And we couldn't make it at the first time to get everybody in there, but that was the future plan. And some of the recommendations is to do more of the IPE between universities, and we need more social awareness about that. And we totally agree with that. So to wrap up and just to give a conclusion about such initiatives, I guess, about interprofessional education in Jordan, we thought that the activity has improved the students' impressions and attitudes about interprofessional education and collaborative practice. And they were eager actually to find and to see more such IB activities in future, or to be incorporated into their curricula. And that was actually some of the the ultimate goals actually for such work. And we're looking just to have a plan about how we're going to incorporate such of these activities, and like in the curricula, which is not really easy given the huge number that we have of students and the various health professions that we have also at the university. But overall, students were satisfied, they like it, and all positive impressions and, attitudes were observed. This work has just been published in the Journal of Interprofessional Care, and that's actually the chance just to thank my collaborators. In this work, we have Dr. Zaid Al-Hamdan from the School of Nursing, Dr. Ala from Qatar, Dr. Hana from Clinical Nutrition, Dr. Nasreen Saada from the School of Medicine, and we have Hadil, which was the clinical pharmacist that contributed to the development of the case study. We did not stop at that point in there. We had also another activity that was done last year before I came to the US. And we tried just to get some of the recommendations that were highlighted by the students. We expanded a little bit in such IPA activity. We have paramedics now and dentistry that were included. And I think the case study was about cardiovascular disease. We did not do the post and the pre design. It was just like interprofessional workshop, just to have another integration of such workshop and to improve the awareness of students about IPA and collaborative practice. So I think the activities and workshops are being increased nowadays, I think, within the university. And what I think the major aspect that we should look for during the future research is to look at how IPE, it does improve the health outcomes. As I mentioned, there's a lot of studies have established the interprofessional collaborative practice and its impact on improvement the patient and the delivery of the patient care. But little has been done actually about whether IPE has an improvement in the patient outcomes. So I was invited to write a book chapter recently by Dr. Naemi, and I think many of you has contributed to writing of that such textbook. So the book is The Noble Health Interprofessional Education and Collaborative Practice Programs, Strategies and Implementation. And myself and my collaborator, Dr. Mohammed Al-Mansour from Department of Clinical Medical Education, sir, from the School of Medicine in King Saud University. We reviewed the literature and we wrote a chapter about interprofessional education and collaborative practice impact on healthcare outcomes. And I think we highlighted in that chapter that has not been released yet. I think next month the book chapter will be released by Springer. And what we observed in the literature that it's a lot in there about collaborative practice and its impact on patient outcomes, but little is published regarding IPE. And I think that should be maybe the major aspect to look at it during future investigations. So the current status and future plans for our IPE activities in Jordan, I think these activities and the data from the surveys would be important to develop such a foundational piece about how IPE faculty members as well. We are looking to form a local IPE committee, institutional committee actually within just to have plans and to help with organizing such incorporation of IPE within the curricula, and to improve, the contribution of Jordanian faculties to the IPE network of the Arab-speaking countries, the IPCAN. And as I mentioned, we have a couple of representatives from Jordan in that network, and we are actually eager to contribute significantly to the development of such network and to have it move from, an emerging to a formal network with an interprofessional global. And I think we had a couple of meetings led by Dr. Ala Al-Iwaisi with that perspective. And we should have plan actually soon after maybe the conference in Qatar about how we're gonna, establish such an IPE activity and to have such an impressive outcomes about IPE. And I think that's it. That's what I have for today. And I thought, sharing some information about what we know in Jordan about interprofessional education and collaborative practice will open avenues for you guys just to know about what we have done in Jordan and for any future collaboration. Thank you so much, and I'll be happy to take questions.
Thank you, Osama. Excellent presentation. I believe, Hester, do you have your hand up to ask a question?
No, I was clapping as a thank you for the presentation.
It's hard to tell the wave from the clap, so no, very nice. So I do have a question for you, Osama. How do you feel that IPCAN network is coming together? I know a lot of the work has really been has really kind of been concentrated in Qatar and in the UAE, and Saudi Arabia. Do you feel that more and more countries and are really kind of jumping on board to that regional network?
Yeah, actually, yeah, thank you for that question. I think we're doing a good job so far. We had a couple of meetings, as I said, led by Dr. Ala. We meet every other month, sometimes just trying to, establish the major goals and, outcomes of such, network. And I think last time we met that we had contribution from various countries in the Middle East and North Africa region as well. And we did separate the representatives into groups who are going to work maybe later on in doing some analyses, institution analyses, and to have some recommendations about, how we're going to have it to be a formal network with the Interprofessional Global. I think that things are going nicely so far. And when we meet in Qatar, inshallah, hopefully things inshallah will be improved. So we didn't get the chance to know each other that much, but in Qatar, we're going to get the chance to meet in person, and we're going to have an ideas about how we're going to move forward.
Agreed. I'm looking forward to seeing all of you in Qatar, and it's very interesting how you mentioned the textbook, because I did collaborate on one of the chapters also. So
yeah.
I'm excited to see that in print. Osama, would you mind unsharing your PowerPoint so people can see each other a little bit better?
Yeah, sure.
Good. Does anyone else have any questions? Feel free to ask.
Any questions?
Hi, am I audible?
Hello?
Hello, am I audible?
Yeah, can you just speak a little bit louder so we can hear you?
Am I audible? No. Okay.
Yeah. Nabil, do you have a question?
Yes, maybe I can put it in the chat box. Yeah, if I'm not audible.
Okay, I'll let Nabil ask this question, and then you can.
Okay.
We'll answer your question in the chat box. Thank you.
Can you hear my voice?
Yes. Yes.
Okay. Hello, everybody. Dr. Osama, thank you for this interesting presentation. I have a couple of questions. Did you, in your study, did you try to see if there was a difference in opinion between doctors and the nurses and the pharmacists?
Yeah, that was actually a great question. Yeah, go ahead.
Yeah, and then the second question, in your results, I've noticed that I know that to start with, most participants had a positive attitude. However, that attitude didn't change regarding patient-centeredness and professional biases. Do you think this is going to be a problem area in the future? So, I mean, I have these two questions to ask. But I congratulate you on this work, and I think this opportunity, maybe in the future we could, I'm from Egypt, and in Alexandria, we are establishing a small center on interprofessional education, but in the field of patient safety. So that might be an area to work on in the future. Thank you.
Yeah, sure. Thank you, Dr. Nabil. And it's really great to hear from you that things are going forward in Egypt with that perspective. Oh, yeah. So for the first question, I did like a subgroup analysis where I looked whether there was a differences in gender or discipline with regard to the, the pre and post scores, and we could not find any significant difference. between disciplines or the gender effect. And I think part of that could be related to the small number of students who contributed to the study, where the total was 40. And when you talk about the disciplines between 7 and 10, so it was a small number in there, and we couldn't find any differences. And that's for the other question, which is really another excellent question. We could not find a significant improvement with the patient-centeredness and the other one, which was like community-centeredness, I guess. And I think that could be related to the type of questions included in that subdomain. You know, like the patient-centeredness, the majority of questions were related about whether as a healthcare provider, you have to develop a trust relationship with the patient. You have to think about the patient as a primary of the care, as an outcome of the care. And logically, you know, every healthcare provider should have agreement, you know, like about these statements. I think, and they have a positive impression about these statements and positive agreement that did not change that much after implementing such an IP activity. So I think, you know, it depends on what kind of statements are in there with regard to the subdomains of the IPAS. But the things that are improved, it actually it was observed during the interprofessional activity, because things about roles and responsibilities, the teamwork, the effective communication, these are the other major aspects of the IPAS that have been improved in there. These, I think that students have felt it or have observed it during such interprofessional workshop, and that was we have observed a significant improvement.
Thank you very much.
Sure.
And there is a couple questions in the chat. Quincy Fernando asked, did your case-based learning include faculty from all professional groups? And do we need to have representatives of all professions in faculty group equivalent to learner professional group, or can we have any combination of faculty facilitating these events?
Yeah, I think the second question, yeah, we need a faculty actually member representative from different disciplines just to have this workshop successful. So for the first time for me, so I am a pharmacist, and when I started to develop the clinical case study, I couldn't have that much information about the contribution of the nurses in that case, and you know, the nutrition, and I thought that no, we should have an interprofessional faculty team that guarantee that we're going to have a representation from, or the contribution from, every discipline in the development of the pharmaceutical care plan. So I think it's really necessary to have a multidisciplinary team at the beginning to organize such an IB activity. What was the other question? Sorry, I missed that.
Oh, it was, did your case base include faculty from all professional groups? So I think you kind of answered that question. So you did attempt to have multiple professions involved, but
Yeah,
it would be good moving forward.
sure.
Any other questions? Well, Osama, I would say you did a fantastic job with your presentation. Good job.
Thank you.
We will have a recording of this posted on our website. So if you want to share it with others, you
Sure.
can do that. And we look forward to seeing you at Altogether Better Health in Qatar and talking more about this.
Yeah, I'm excited actually, and thank you everybody for attending today and for your attention. Thank you for your time. I know the timing here is really difficult. It's 5 p.m. in Jordan, 10 a.m. in Pittsburgh. I'm not sure the other countries how the time works for them, but thank you really for attendance today.
There's one more question in the chat.
Oh, okay.
You're going to probably have to scroll up to find it.
How could it be applied? How could it be applied in undergraduates amongst different faculties? Is there any experience with that? How can your program be applied with undergraduates in different faculties?
Yeah, I mean, that's really the challenge, and we keep just thinking about how we're going to have it in the curriculum. I think given the diversity of health professions in our institution and the large number of students in there, what's the plan that we have is to start with having small groups, actually having representative students from different disciplines just to get together and to give the chance for maybe the senior students to be incorporated in such IBE activities. But really to have something established in the curricula, it needs a lot of thoughts, and it needs a lot of trials to be conducted at the beginning. But that's actually in our plan for the future, for sure.
And Richard, did you have something?
Yeah, I was just going to say, I think that question's asking, how do we go beyond perhaps just the faculty of health and social care? So how do we get in with the faculty of, I don't know, education, that's training teachers, that are teaching, housing departments, architecture, that all impacts upon the whole sort of global collaborative healthcare experience. So I think that's what that person was asking.
Yeah, that's it's been acknowledged as one of the major challenge and barriers for implementing IPE, given the diversity of health professions. And it's always hard to get people together, and I can tell from my experience when I start developing such an IPE, to get the students actually from, some of them they are in the second year, fourth year, some of them taking classes, some of them in the clinic. It's not going to be easy to implement, but we're thinking about we are now in Jordan, we are establishing some labs, simulation labs that are designed to be a place of implementing such workshops. They are designed to have groups of multiple students in there. And when we organize the committee, maybe the local committee in the university, we're going to have more plans from these different faculty members from different professions.
Good. Thanks for clarifying that, Richard. I think we're at about time. So once again, nice work, Dr. Alshogran, and hope everybody has a wonderful day.
Thank you so much. Bye-bye.